All right, so let's dive into Maslow's hierarchy of needs.
Yeah.
Um, it's one of those things that I think every nursing student really needs to wrap their head around.
Right.
It's more than just a pyramid you see in a textbook.
Yeah.
It's really a framework for understanding your patients,
Absolutely.
what motivates them, what worries them, what
Mhm.
helps them heal.
It's really about seeing the whole person,
Yeah, right.
and not just the illness. And I think as nurses,
Exactly.
that's crucial for us to remember.
Absolutely. So for our listener out there who's, hitting the books and prepping for clinicals,
Mm.
let's break this down.
Yeah.
What are the essentials of this hierarchy,
Okay.
and how does it actually work in the real world of nursing?
All right. So think about it as a pyramid
Okay.
with 5 levels,
Okay.
starting with the most basic needs at the bottom.
Got it.
And these are the things we absolutely can't live without:
Hmm.
breathing food, water, sleep,
Yeah.
all that jazz.
The
The essentials Maslow called these physiological needs.
Okay. So if those needs aren't met, nothing else really matters.
Exactly.
Right.
It's like trying to study for a big exam.
Right.
When you haven't slept in 36 hours,
You got it.
you're not going to do so well.
I've been there.
Yeah.
And in a clinical setting, I bet you see this every day.
Oh, yeah.
Right.
Every single
You're
day.
monitoring vital signs,
Mm-hmm.
making sure patients are getting enough fluids and nutrition,
Right.
managing their pain so they can rest.
Yep.
It's really all about creating that foundation for healing.
That's exactly right.
I bet this is also where a lot of those essential nursing skills
Yes.
come into play.
Yes.
Things like accurately assessing pain levels
Mm-hmm.
or recognizing the signs of dehydration,
Right.
things that you learn early on.
Absolutely. Those skills are critical, especially in those early stages of care when you're really focused on stabilizing the patient
Right.
and making sure those basic needs are met.
Okay, so we take care of those physiological needs. What's next?
We move up to safety and security.
Okay.
So think about it. Once you know you can breathe and you can eat, you want to feel safe from harm.
Right?
You want to feel secure in your environment.
Mm-hmm.
You want to know that those around you
Yeah.
have your best interests at heart.
That makes sense.
So,
For someone in a hospital bed, especially if they're in a lot of pain or confused,
yeah,
that sense of security must be so important.
it is. They're in a vulnerable position, right?
Yeah.
Often away from their familiar surroundings.
Mhm.
So as a nurse, you are creating that safe space.
Yeah.
It's about preventing falls,
Mhm.
administering medications correctly,
Yeah.
being vigilant about infection control,
Right.
and even just providing really clear and consistent communication
Yeah.
so the patient knows what to expect.
It's interesting because some of those things like preventing falls,
Right.
they might seem like routine tasks.
Right.
But when you look at it through the lens of Maslow, it takes on a whole new meaning.
It does.
It's not just about checking off a box.
Mm,
It's about meeting a fundamental human need.
exactly.
Right.
And those seemingly small things
Yeah.
can have such a huge impact on a patient's overall well-being.
I bet.
When their safety needs are met,
Yeah.
they can start to relax,
Mhm.
focus on healing,
Okay.
and move towards those higher levels of the pyramid.
All right, so we got physiological needs, we got safety needs. What's next?
The need for love and belonging.
Okay.
Humans are social creatures, right?
We
We crave connection, we crave affection,
Yeah,
and we want to feel like we're a part of something larger than ourselves.
absolutely.
And when you're sick or injured,
Yeah.
that need can become even stronger.
It's like when you're feeling down and just having a friend sit with you and listen can be more powerful than any medicine.
It's true.
I imagine it's the same for patients.
Oh, absolutely.
Right.
Hospitals can be lonely places.
Yeah.
They're away from their families, their routines, everything that feels familiar.
Right.
So as a nurse, you become that source of connection.
So it's not just about administering meds and taking vitals.
Yep.
It's about building rapport, having those meaningful conversations,
Right.
treating each patient as an individual,
You got it.
like a human being.
It's about making them feel seen and heard.
Yeah.
It could be something as simple as
Yeah.
taking a few extra minutes to chat with a patient who's feeling isolated, arranging for a video call with their family,
Right.
or even just offering a warm smile and some genuine compassion.
I love that.
These gestures go a long way
I bet.
in fulfilling that need for belonging.
It sounds like a lot of this comes down to those soft skills.
Yes.
Empathy,
Yes.
active listening, being present with the patient.
Right.
Things they don't always teach you in a textbook.
You're right.
Right.
Those skills are just as important as your clinical knowledge.
Yeah.
In fact, I would argue they're what make a good nurse a great nurse.
I think so, too.
They allow you to really connect with your patients on a human level
Yeah.
and provide care that goes beyond just treating the physical symptoms.
That's a really good point.
Yeah.
All right, we're making our way up this pyramid.
Yeah.
What's the next level we need to explore?
We're getting into the territory of esteem needs.
Okay.
The need to feel valued, respected, and competent.
Okay.
It's about having a sense of self-worth and believing in your own abilities.
That's a good one.
Yeah.
And I can see how this would be especially challenging for patients.
Yeah.
Their illness or injury might have taken away their independence,
Right.
their ability to do the things they used to do.
Exactly. They might be feeling a sense of loss, questioning their own capabilities.
Right.
And that's where your role as a nurse becomes so important.
So how can nurses help patients regain that sense of esteem?
It's about empowering them.
Okay.
Instead of just doing everything for them, involve them in their care decisions.
It's like,
Explain their options. Ask for their input and respect their choices.
so it's less like, here's your medication, and more like, here are a couple different options for managing your pain. Let's talk about the pros and cons and decide together what you're most comfortable with.
That's a great example.
Okay.
It's also about recognizing and praising their efforts, even the small ones.
Yeah.
Maybe they managed to walk a few steps further today, or they tried a new technique for getting dressed.
Yeah.
Celebrate those achievements.
It's like you're saying, hey, you're still capable, you're still making progress, and we believe in you.
Exactly. And that kind of encouragement
Yeah.
can make a world of difference in a patient's recovery.
I bet.
It helps them rebuild their confidence and see themselves as active participants
Okay.
in their healing journey.
So we've climbed 4 levels of this pyramid.
We have.
What awaits us at the very top?
The peak of Maslow's hierarchy is self-actualization.
Okay.
The need to fulfill your potential to become the best version of yourself.
That's a good one.
Now, you might be thinking, how does this apply to someone who's stuck in a hospital bed,
Right.
dealing with an illness?
Yeah, at first glance, it does seem a bit of a stretch.
Yeah.
But I'm guessing it's not as far-fetched as it might seem.
You're right. Self-actualization might look different in a hospital setting,
Mm-hmm.
but it's still relevant.
Okay.
Think about it this way. Even when facing a health crisis,
Okay.
people still have hopes and dreams and aspirations.
They do.
They still have that inner drive to learn, to
Mm.
grow, to contribute in meaningful ways.
So even though they might not be, running marathons or writing symphonies, they can still be striving for something more,
Exactly.
right? Something that gives their life purpose and meaning.
Exactly. And as a nurse, you can nurture that.
How so?
It could be something as simple as encouraging them to set small, achievable goals for their recovery.
Okay.
Maybe they want to be able to walk down the hallway unassisted
Yeah?
or start cooking their favorite meals again.
Okay. Or maybe reconnect with a hobby they've neglected.
Yeah.
Or learn a new skill while they're recovering.
Exactly. It's about helping them tap into their inner resources
Mm-hmm.
and recognize that even in the midst of illness, there's still room for growth and fulfillment.
And sometimes I bet those conversations about self-actualization can lead to some pretty profound moments
They can.
with patients.
Yeah,
So we've now covered all 5 levels of Maslow's hierarchy of needs.
we have.
But I have a feeling there's more to this story than just climbing a ladder.
Yes, there is.
All right.
There's a key distinction that's often overlooked, but it's crucial for nurses to grasp.
Lay it on me. I'm intrigued.
Okay. It is the difference between deficiency needs
Okay.
and growth needs.
Okay, I'm listening.
The first 4 levels we talked about,
Mm.
physiological safety, belongingness, and esteem,
Yeah.
those are all deficiency needs.
Okay.
Think of them like those warning lights on your car's dashboard.
Okay.
When those lights flash.
Yeah.
Something needs attention
Right.
to avoid bigger problems down the road.
So if those needs aren't met, there are negative consequences.
Exactly.
Like if you're running on empty, your car's not going anywhere.
Right, and it's the same with people.
Yeah.
If you're severely dehydrated, you'll experience physical distress.
Mm-hmm.
If you constantly feel unsafe, you'll be consumed with anxiety.
Yeah, that makes sense. So where do growth needs fit into all of this?
Growth needs esteem and self-actualization. Those are different.
Okay.
They're not about avoiding pain. They're about striving for something more.
Okay.
It's like that feeling you get when you're learning something new,
Yeah.
mastering a skill, or
Mm.
making a meaningful contribution to the world.
I see. It's not about filling a void.
Right.
It's about reaching your full potential.
Exactly.
So how does this distinction between deficiency needs and growth needs actually play out in nursing practice?
It changes your approach to care.
Okay.
So let's say you have a patient who's in agonizing pain.
Yeah.
Your priority is to address that immediate physiological need. You're focused on pain management, making sure they're comfortable.
Mm-hmm.
But what if you have a patient who seems withdrawn and isolated,
Okay.
even though their physical needs are being met?
Interesting.
Yeah.
Then you might need to dig a little deeper.
You do.
Maybe they're struggling with feelings of loneliness or a loss of independence.
Exactly.
And simply addressing their physical symptoms won't be enough.
It won't.
Right.
You have to consider the whole picture,
Yeah.
their emotional state,
Mm-hmm.
their social support system,
Right.
their sense of purpose.
And that's where understanding Maslow can be so powerful.
It is.
It helps you see beyond the surface and address those underlying needs that might be driving their behavior.
Yeah,
You know, this is starting to feel like detective work almost.
I like that.
Using Maslow to decode what patients really need,
Yeah.
even when they don't have the words for it.
I love that analogy. And the more you understand this theory,
Yeah.
the better you'll become at recognizing those subtle cues and tailoring your care to meet those individual needs.
So it's really moving beyond a one-size-fits-all approach
It is.
and recognizing that each patient is unique.
Absolutely.
Okay, so we talked about the different levels of the hierarchy.
Mm-hmm.
This crucial distinction between deficiency needs and growth needs.
Yep.
Anything else we should keep in mind?
One last thing.
Okay.
People don't always neatly climb this pyramid
Right.
from one level to the next.
I can imagine.
Life throws curveballs.
Yeah.
Our needs can fluctuate
Right.
based on all sorts of factors.
So you're saying a patient might be making great progress on one level.
Right.
Maybe they're regaining their physical strength,
Mm-hmm.
starting to feel more independent.
Right.
But then something happens, a setback,
Yeah.
a piece of bad news.
Mm-hmm.
And suddenly their focus shifts back to those more basic needs,
Exactly.
like safety and security.
That's exactly right. And as a nurse, you need to be adaptable,
Yeah.
recognizing that a patient's needs can change from day to day, even hour to hour.
Yeah.
It's about meeting them where they are and
Mhm.
adjusting your approach accordingly.
This is where it all starts to click for me. It's not about memorizing a rigid pyramid.
Right.
It's about understanding the underlying principles
Yeah.
and applying them to the unique circumstances
Mm,
of each patient.
I couldn't have said it better myself.
Right.
Maslow gives us a framework, but it's up to you
Mm-hmm.
to use your clinical judgment,
Yeah.
your empathy, and your intuition to make it truly meaningful.
Okay. I'm feeling pretty good about the theory. But as a future nurse, I learn best by seeing things in action.
Of course.
Can we dive into some real-life scenarios that show how Maslow's hierarchy plays out in a nursing context?
Absolutely. Let's bring this theory to life with some vivid examples you might encounter in your clinical rotations.
Okay.
Ready to put your Maslow hat on?
Let's do it. I'm all ears.
All right. Imagine a patient who just had major surgery.
Okay.
They're coming out of anesthesia, they're groggy,
Mm.
they're in pain, and their primary focus is on finding relief
Yeah.
so they can finally rest.
Okay, so their physiological needs are front and center at this point.
Right.
Pain management,
Uh-huh.
making sure their vitals are stable,
Yep.
creating a calm and comfortable environment.
Exactly. In that moment, those basic needs take precedence over everything else.
What about a situation where safety needs are paramount?
Okay, picture a young child who's been rushed to the ER after a bike accident.
Okay.
They're scared, they're in pain, they're surrounded by strangers in a strange environment.
Yeah.
And they're separated from their parents.
You can practically feel their anxiety just from that description.
Right, and in that situation,
Yeah.
your job as a nurse goes beyond just treating their physical injuries.
Yeah.
You are creating a safe space for them, both physically and emotionally.
I like that.
You're speaking in a calm, reassuring voice,
Yeah.
explaining what's happening in terms they can understand.
Mm-hmm.
Maybe you even bring in a favorite stuffed animal. Or let them hold your hand while the doctor examines them.
Yeah.
It's about easing their fears,
Mm.
helping them feel protected.
That's such a powerful reminder that nursing isn't just about medical skills.
It's not.
It's about human connection,
Yes.
especially in those moments of vulnerability.
It really is. And speaking of connection, let's talk about a scenario where belongingness needs are really prominent.
Okay.
Imagine an elderly patient who's been hospitalized for a long time.
Okay.
They might be recovering from a fall, dealing with chronic pain, or maybe they've just been feeling increasingly frail and isolated at home. whatever the reason they're now in a hospital bed, away from their familiar surroundings and their loved ones.
That kind of isolation can be devastating, especially when you're already feeling vulnerable and unwell.
Absolutely. And this is where your role as a nurse becomes even more crucial.
Hmm.
It's about recognizing that loneliness
Yeah.
can be just as debilitating as any physical ailment.
So what can nurses do to address those feelings of isolation and help patients feel more connected?
It's about those small acts of kindness
Yeah.
that make a big difference. Taking a few extra minutes to chat with them,
Mm.
asking about their lives, their families, their
Mm.
interests. Maybe you help them set up a video call with their grandkids
Yep.
or arrange for a volunteer to visit and read to them.
Right.
Sometimes just having someone to talk to can be the best medicine.
It's amazing how those seemingly small gestures can have such a profound impact
They can.
on a patient's well-being. Okay, let's move up the pyramid again. What about an example where esteem needs are at the forefront?
Think about a patient who's struggling to cope with a new disability.
Okay.
Maybe they've had a stroke that's affected their mobility,
Yeah.
or they're dealing with vision loss.
Right.
They're facing a whole new reality,
Mm.
and their sense of self-worth might be shattered.
Yeah.
They might feel helpless, frustrated, and like they've lost their independence.
It's heartbreaking to imagine what they must be going through.
It is, and in that situation,
Yeah.
your role as a nurse is about so much more than just providing physical care.
Right.
It's about helping them rebuild their sense of self-esteem and find ways to adapt to their new reality.
So how do you do that? What are some concrete ways that nurses can support patients who are struggling with their esteem needs?
It's about empowering them, even in small ways.
Okay.
Maybe it's helping them learn to use adaptive devices so they can regain some independence with daily tasks.
Okay.
Or maybe it's encouraging them to participate in physical therapy, even if it's challenging at first,
Right.
and celebrating their progress along the way.
So instead of just doing things for them,
Right.
it's about encouraging them to do things for themselves at their own pace.
Exactly. It's about recognizing and praising their efforts no matter how small.
Mm-hmm.
And it's about helping them see their strengths even in the midst of their challenges.
And what about self-actualization? How does that highest level of the pyramid play out in a hospital setting? It's not like you can expect patients to be having, major creative breakthroughs or achieving peak performance
Right.
when they're dealing with an illness.
You're right. Self-actualization might look different in a hospital setting,
Mm-hmm.
but it's still relevant, remember? It's about that drive to reach your potential to live a meaningful life, even in the face of adversity.
Okay, so give me an example. How can nurses support those aspirations in patients who are hospitalized?
Let's say you have a patient who's recovering from a serious illness like cancer.
Okay.
They're starting to feel stronger,
Mm-hmm.
but they're also facing a lot of uncertainty about the future.
Right.
They might be worried about their finances, their relationships, their ability to return to work.
Right.
In those moments, your role as a nurse can be about helping them reconnect with what truly matters to them.
So it's not just about getting them physically healthy. It's about helping them find their footing again,
Exactly.
their sense of purpose.
Exactly. It could be about having those deeper conversations,
Mm-hmm.
asking them about their passions, their goals, the things that give their life meaning.
Okay.
Maybe they've always wanted to learn a new language,
Okay.
or write a book, or volunteer in their community.
And maybe as they're recovering, you can help them connect with resources or support groups
That's a great idea.
that align with those interests.
It's about recognizing that even though they're in a hospital bed,
Yeah.
they're still whole people with dreams and aspirations.
Right.
And those things don't just disappear because they're sick.
This has been so eye-opening. I'm really starting to grasp the power of Maslow's theory in action.
It's amazing, isn't it?
It's about so much more than just checking off boxes.
Mm-hmm.
It's about understanding that intricate web of human needs
It is.
and finding ways to meet those needs with compassion and skill.
I couldn't have said it better myself. So how do we know if we're on the right track? How can we be sure we're applying Maslow's hierarchy effectively in our nursing practice?
It's a great question, and it leads us perfectly into the next part of our deep dive, testing your knowledge. We're going to challenge you with a few NCLEX-style questions to see how you can apply what we've discussed, ready to put your Maslow knowledge to the test.
All right.
Bring on the challenge. I'm ready to see how I stack up.
Okay, let's get started. Here's your first question. A patient admitted with pneumonia is experiencing shortness of breath and is visibly anxious according to Maslow's hierarchy of needs. Which need should the nurse prioritize?
Okay, that's a good one. Let me think this through. We've got a patient struggling to breathe, so that's a major physiological need, oxygen. But they're also anxious, which points to safety and security needs not being met. It's a tough call.
It is a classic nursing dilemma. You often have to juggle multiple needs at once. What's your gut instinct telling you?
My gut says you can't be secure if you can't breathe. So I think the nurse should prioritize addressing the respiratory distress. First, get that oxygen flowing, maybe administer some meds to ease the breathing.
You're spot on in this case. That immediate physiological need for air takes priority. And you're right, once that breathing improves, the anxiety will likely decrease too. You're essentially hitting two needs with one intervention.
Okay, that makes sense. It's like Maslow himself is whispering in my ear. Air first, then we'll talk about feeling safe. What's our next challenge?
All right, next scenario. A patient who recently had a stroke is struggling to feed themselves. They're getting frustrated and withdrawing from interactions using Maslow, which nursing intervention would best address this situation.
This one is multi-layered, isn't it? On the surface, it's
Yeah.
about getting the patient nourished, a physiological need, but they're also clearly having emotional distress and maybe some social isolation. This isn't just about food, it's about dignity and connection too.
You're picking up on those subtle cues. It's not always what's being said, but what's going on beneath the surface. What would your intervention look like?
I wouldn't just swoop in and take over mealtime. Instead, I'd assist the patient with feeding, but encourage them to do as much as they can on their own. It's addressing the need for nourishment, but also supporting their esteem needs, letting them maintain some control, which is probably feeling pretty shaky right now.
That's excellent, thinking you've woven Maslow into a very patient-centered approach. And you know what else could boost that sense of belonging?
Ooh, tell me.
Maybe arrange for some company during meals, a familiar face, a volunteer, even just making sure their roommate is around can combat that isolation. Food is so much more enjoyable when you've got company.
You're right, a simple thing like that can make a huge difference. This whole hierarchy is really coming together for me. Ready for the next one?
All right, last one, and it's a tough one. A terminally ill patient in hospice care expresses a desire to reconnect with estranged family members. How does this connect back to Maslow, and what can the nurse do?
Wow, that's heavy. Even though the patient is nearing the end of life, they're still experiencing human needs, and their wish to reconnect with family screams love and belonging to me even stronger now, maybe?
Absolutely. It's easy to assume that as people approach death, only their physical comfort matters. But Maslow reminds us that those emotional and social needs don't just vanish.
So even though the focus might be on managing pain and symptoms, this person's desire for reconciliation and closure is just as important, and the nurse is in a unique position to help.
Yes. What specific actions could you take?
Well, first, just listen. Provide emotional support. Be that safe space for the patient to share their feelings and fears. Then maybe help them figure out how to communicate their wishes to those family members. Depending on the situation, the nurse could even reach out to those family members on the patient's behalf.
You're demonstrating incredible compassion and understanding. You've hit on a key takeaway. Maslow's hierarchy applies across the lifespan, even as we face the end of life. A nurse's role is to advocate for the whole person, and that often means going beyond the medical chart.
These NCLEX-style questions have been so helpful in seeing how Maslow translates into real nursing decisions. But I have to ask, is there ever a time when those higher-level needs like self-actualization actually come into play in a hospital?
It's a great question, and one that often makes people scratch their heads. It's true, you're not likely to see a patient having a major artistic breakthrough while recovering from surgery. But remember, self-actualization isn't about grand achievements. It's about moving toward your potential, whatever that looks like in a given situation.
So how do you even begin to tap into that with someone who's dealing with an illness or injury?
Sometimes it's about those seemingly small but significant conversations. Let's say you have a patient who's been struggling with chronic pain. Maybe they've had to give up hobbies they loved or make major lifestyle changes. You might gently ask them what brings them joy, what they're still passionate about, even if it feels out of reach right now.
So you're not trying to fix their pain or solve their problems. You're just acknowledging that they still have those desires, those dreams, even in the midst of what they're going through.
Exactly. And sometimes just voicing those aspirations, even if it feels impossible at the moment, can be a spark.
Mm.
It can be a reminder that they're not just a patient, they're a whole person with a unique life story.
And maybe as they start to feel stronger, you can help them explore ways to reconnect with those passions.
Yeah.
Maybe it's finding adaptive ways to engage in their old hobbies or discovering new ones that fit their current limitations.
Exactly. It's about recognizing that even when facing health challenges, there's still room for growth and self-discovery. And, sometimes those conversations can be incredibly powerful both for the patient and for the nurse.
Yeah, I can I can think about times when I was in college and just so stressed out, cramming for exams and, pulling all-nighters and just like forgetting to eat, forgetting to sleep.
Totally.
It's like all those higher level needs,
Right.
learning, achieving just kind of went out the window until I felt like I had a handle on the situation.
And that's exactly the point, right?
Yeah.
When those basic needs are screaming at you, it's hard to focus on anything else.
Right.
And so I think by reflecting on our own experiences, you gain a deeper understanding of just how powerful those needs are.
So you're saying that by tapping into our own experiences, those times when we felt hungry or scared or alone, we could actually become more empathetic nurses.
Precisely, when you've walked a mile in those shoes, you're better equipped to recognize those same needs in your patients, even if they express them differently.
It's like that saying you can't truly understand someone until you've walked a mile in their shoes.
Yes.
And I think by connecting with those like shared human experiences, it helps us build that bridge of understanding and compassion.
That's a perfect analogy.
Yeah.
It helps us see our patients not just as medical cases,
Right.
but as whole people with complex needs and emotions. And that's the heart of nursing.
Yeah.
Providing care that's not just clinically competent,
Right.
but truly humanizing.
I love that this is really resonating with me. It's like Maslow's hierarchy isn't just a theory. It's a pathway to like deeper empathy and more meaningful connections with our patients.
And that empathy, that connection, that's what makes a good nurse a great nurse.
This has been such an eye-opening deep dive.
Yeah.
I feel like I've gained a whole new perspective on what it means to care for patients holistically.
I'm so glad to hear that. And it's funny how something as simple as a pyramid can hold so much wisdom about human nature.
I know.
It's like Maslow cracked the code
Yeah.
of what it means to be human.
But I gotta ask, is Maslow's theory still relevant today? I mean, it was developed decades ago.
Right.
Hasn't psychology evolved since then?
It's a great question, and the answer is a resounding yes.
Okay.
Maslow's work was groundbreaking, and it's still incredibly relevant.
Right.
But you're right, psychology is constantly evolving.
Yeah.
Researchers are always building on existing theories, refining them, and adding new perspectives.
So what are some of the newer ideas that are kind of shaping our understanding of human needs?
Well, for example, some researchers have proposed adding a level beyond self-actualization, a
Oh,
level called transcendence.
transcendence. That sounds pretty deep. What does that even mean?
It's about going beyond your own individual needs and connecting to something larger than yourself,
Okay.
whether that's through spirituality, altruism, or creative expression.
Okay.
It's about finding meaning and purpose beyond your own ego.
I like that.
Think of those individuals who dedicate their lives to a cause or find deep fulfillment in helping others.
Wow, that's a whole other level of human potential.
Yeah.
I could see that would be a natural progression from self-actualization. Once you've figured out who you are, you start to think about how you fit into the bigger picture.
Exactly. And while transcendence might not be something you're directly addressing in a hospital setting, it's still a fascinating concept to keep in mind.
Yeah.
It reminds us that human potential is limitless,
That's beautiful.
and that even in the face of illness or suffering, people can still find ways to connect to something larger than themselves.
This has been such an incredible learning experience. I feel inspired and ready to apply this knowledge, in my future practice.
That's wonderful to hear. And remember, this is just the beginning of your journey with Maslow.
Mm-hmm.
Keep exploring, keep questioning, and most importantly, keep that human connection at the center of your care.
I will definitely do that. Thanks for being such an amazing guide on this adventure.
It's been my pleasure. And to all our listeners out there, keep learning, keep growing, and keep striving to provide the kind of care that honors the full spectrum of human needs.
Well said.
Until next time.